Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. Hope you're all doing well. So today we're going to talk about a very important topic that is completely ignored by traditional approach. And once you see my messy desk and all the articles that I have here and references to these, you'd be amazed as to the problems that we have and that can arise as a result of exposure to heavy metals. Specifically arsenic, lead, mercury, cadmium, nickel, aluminum, and many more. This is something I've been looking at for my entire career. And I think that once you see the literature, once you see the research on how heavy metals correlate with heart disease and plaque, heavy metals correlate with neurologic disorders, Parkinson's, MS, Alzheimer's, heart failure, organ failure, cancers, the list is very long. And showing this mechanism and explaining how this works, you'll get the idea. And that's why we typically, for every patient that comes in, except maybe, teenagers and the younger population, we check the blood for heavy metals. The blood test will tell us what recently has come into your system. It's free floating in your blood. And the second step that we might do is a urine test to look at what's leaving storage. And that may be a random urine, looks for 21 metals. Blood labs only test for 5 metals. And when those show up, we may do an intravenous treatment with calcium EDTA to bind to the metals and to pull them out into the urine. And you're looking at the urine after the IV treatment to really see what's coming out. And the proof of this mechanism working, besides tons of literature, is that once you repeat a urine after maybe 10 treatments, you'll be able to see the first urine result and the 10th urine result and see how much of these things have been depleted. So the literature is rife with topics and studies on this. So there are studies that talk about heavy metals that correlate with brain cancer. And this is not just one article. This is one good article that talks about how metals, including cadmium, lead, arsenic, mercury, thallium, cross the blood-brain barrier and cause reactive damage to the brain, mitochondrial dysfunction, calcium ion changes, an immunogenic response, suppression of antioxidants, including glutathione. And there's an important topic because as I jump a little bit over to a different study talking about how heavy metals correlate with Parkinson's disease, when research was done in Italy on people that had Parkinson's disease that had passed, and they did sectioning of brain tissue and they looked at the entirety of the brain, they found that there was no glutathione there to protect from free radical damage. So the belief is that the heavy metals damage your brain's ability to create and to make and to harbor glutathione, which is a great free radical scavenger. So the list of the complexity of this, the list is very, very long, but I'm going to try to make it easier to understand, and that every adult really should be testing blood and urine for heavy metals. There are a variety of studies that talk about heart disease and how plaque and cardiovascular disease can be influenced by heavy metal exposure. Routinely in the office, when I talk about metals with patients or those that have cardiac disease or plaque, we'll talk about how the metals bind to the bad LDL cholesterol and become a foam cell. And that foam cell now could adhere to the blood vessel wall and become plaque. And there are many studies that describe this. This is another great study talking about association between heavy metals, high C-reactive protein, 10-year risk of cardiovascular disease. This also, great study, points out the foam cell that I just mentioned. And pretty fascinating. 14%, 10%, 11%, 22% increases. So more reason to understand what's happening in your body beyond the obvious. There are so many things that occur inside your cells. It's like a whole universe inside your cells. When we talk about mitochondria, Golgi apparatus, the discussion is vast. But suffice it to say that you want to protect your cells. You want stuff that's bad not to get into your cells to cause the damage. On the outside of every cell are receptors, and those receptors need to bind magnesium, potassium, calcium, iron, a variety of healthy minerals. But because the heavy metals are 2+ and 3+ charge, they may bind where the minerals should bind, and now that cell will be damaged because it's not getting the minerals it should, and these other substances are getting in the way. Autoimmune disorders, also significant correlation with heavy metal exposure. Mercury and lead, talking about damage to the brain. autoimmunity, inflammatory conditions. This also talks about the benefit of chelating the metals out, which is a terrific study because it talks about how this occurs and then what you can do to help to change the picture. So, as I say, a great deal of information, and I have a ton of other studies that would support this. We have many patients over the years that we've done chelation therapy for that have had great results. Bind the metals, pull them out. People typically would do chelation. It's an IV that takes about a half hour to do once a week. And then repeating the urine for heavy metals after the IV shows you that you're depleting those metals. So important to understand how that works and how that the metals can contribute to organ damage and problems throughout your entire body. Okay, phone lines are open if you'd like to call in to ask your question, 888-420-9272. Even before we announce that we have someone on?
Yeah.
Great. Let's go to our first caller. Hi there, how are you? Who am I speaking to?
Hello. Is it Doctor?
Yes.
Hello.
How are you?
Doctor?
Yes.
Good. Yes, hi, my name is Patrick. How are you doing?
Good, Patrick. How are you?
All right. Since this new pickleball sensation has started, I've developed a huge pain in my elbow.
Okay.
And I don't know what to do with it.
Well, that's common. Just like with tennis or even to a far lesser extent, ping pong, turning over your wrist and making a movement that can put some extra strain on the muscles that go to tendons that attach to the bone or the ligaments that attach bone to bone can create that discomfort. For a lot of people, it's mild. It'll go away. Some people will put some cold compresses on, maybe alternate that with a little bit of heat, do some stretching, anti-inflammatory. But if it doesn't go away with very easy, straightforward recommendations, then you need to do an MRI because you want to see the entirety of the joint. X-ray only shows you the outline of the bone, and most people have seen an X-ray. There's, white for bone and dark, black space where there's nothing bouncing back to the X-ray plate. But the MRI shows you ligament, tendon, cartilage, everything in the joint. For some people that have a mild wear and tear, we might do something simple like platelet-rich plasma therapy, where we take your blood, spin it, and get 7 growth factors from your blood and just pepper it throughout the area, going to where the ligaments may be pulling and irritating the bone, or where you may have some tears in ligaments or in tendons. And of course, there are people that have some muscle wear and tear. You could inject the platelet-rich plasma into that. So that can work really well. It's a mild mechanism. Yeah.
I've tried the ice, and that's a 50-50 on me.
Well, it's good to try it. I mean, you're going to decrease some inflammation from using the ice, but you may have a little bit more wear and tear than the ice can help. So if it's a very mild irritation or inflammation, ice might help, Motrin might help. But if that doesn't help, or if you're playing a good amount and it's more than that, then we have to get a better picture of it. So the MRI is always the best test. And then from that, we can determine, what can be done. Everybody in the world is playing pickleball. Every patient I talk to is playing pickleball. And now they're aggravated because there's not enough courts, there's not enough people to play with. It's, it's a frenzy.
It's addicting.
I think it's a great idea because it gets a good amount of exercise. You move around a bit. It's not, too dangerous, but, I guess it depends how hard you play.
All right. Thank you very much.
Thank you so much for your call. Yeah, I have friends that play pickleball, and they're saying that it gets into some really tough competition. And I say, pickleball, really? But, people are competitive, and they want to hit the ball hard, and they want to move around and dive. It's fascinating to me. But, hey, I think it's a good activity. And I haven't seen many people yet that have injuries. Few people twist their ankle or their knee because they're not used to moving laterally back and forth as much. But start off slow.
I'm hearing a few Achilles issues.
Oh, yeah. Sure. Because if you've done no exercise and you start doing an activity, and this is an important comment, if your muscles are not stretched that much and you're doing an activity that stretches beyond your basic capacity, you can create wear and tear. However, if you stretch your muscles out, and I tell people to be sport specific, if you're playing pickleball or tennis, make sure that you stretch your body in the full length of that movement, if it's a backhand or a full length if you're lunging and reaching for whatever ball. And this holds true for golf and baseball and everything else. If you don't have a good full range of motion stretch, you can become injured. If you have a good stretch and you're able to really move backward and forward, and you go into a range of motion that's already inside that good stretch, you're not going to hurt yourself. So it makes sense. Okay, phone lines are open, 888-420-9272. 888-420-9272. I guess pickleball might be the magic word.
Hello, sir. You are live.
Hi, how are you?
Hey, how are you?
Good, good. How can I help you?
Hi. Hey, Dr. Calapai. So I was wondering, so I was listening to the conversation about pickleball and everything else. So I hurt my back years ago, and can STEM help me with my back?
Sure.
Or, yes?
Stem cell is the ultimate mechanism of repair, and that's been documented a million times. The literature on it is vast. There are over 4,000 at present clinical trials on clinicaltrial.gov looking at stem cell and creating trials to prove even further that this technique can work for just about everything that we see in degenerative disorders, whether it's joint or organ disorders. And we've seen this with patients. So there's a massive interest in stem cell, and there always has been, but lately it's exploding because of all the proof that we see with patient care. So with back problems, it depends upon which tissues are involved to kind of categorize it. So you might have a sprain in a muscle and have no disc problems, no ligament problems, no tendon problems. So that's a milder form of a back issue. Over time, if you have some injury, you fell off your bike, you slipped on the ice, car accident, then more tissue could be irritated. That could be the ligaments that hold the bones together, or the tendons that go from muscle to bone, muscle to tendon to bone, or the attachment of the tendon onto the bone. So, as I always maintain, in a perfect world, if we do an MRI of your back, we'll see everything that's happening. Some people will have a disc bulge that transiently may irritate the back because they're pushing up against that disc and it's hitting the nerve root, whether it's on the right side or the left side. Some people have a combination of a disc bulge or a disc herniation, where the nucleus inside that disc is now stuck on the outside edge and it's constantly hitting the nerve. So there are different modalities that we want to do to be able to improve the picture. So I always talk about the comprehensive nature of what I do. So we might do some stretching, might do some traction for the muscle component. If the MRI shows that you have some wear and tear and damage to ligaments and tendons, which is extremely common, yes, stem cell therapy would be ideal to place them to that ligament and tendon to create growth and repair. If you have disc issues, we might also add a specific traction mechanism called a VAX machine, and that you can lay on a table and stretch out so you're taking some of that muscle spasm and pressure off the disc. So there are different things that can be done depending upon what you have. Is it constant pain or is it on and off?
See, so I think the pain is from weight, right? So I had lap band surgery years ago.
Ah, okay.
Went down from 400 pounds to 270.
Wow.
Then the, doctors all over the place said, try Ozempic, try this, try that. No one has ever actually given me, if I go on hormone replacement therapy or something like that and maybe do STEM, I don't know, but I would like to.
Good comment. Good additional comment and question. So this is a great thing to talk about because a lot of people don't realize that extra weight is putting a lot of gravity pressure on your spinal column. And then to some extent, the pressure on your low back because of the curve in your low back pushes downward and forward, towards the center, and that can push back on the discs and hit the nerve. So, yes, helping to decrease the weight makes all the sense in the world. In individuals and you could use, I recommend low-carb diet, exercise every day, half hour to 45 minutes of nonstop exercise, correcting vitamins, minerals, and hormones. And hormones certainly, if they're low, would make it hard to bring down the weight. And when you correct the hormones, testosterone, DHEA, thyroid, IGF-I, the active component of growth hormone, that person becomes a far better fat-burning machine so that you can further get that weight down and regain the function you had when your hormone levels were better. So this, as I say, is a comprehensive approach to correcting vitamins, minerals, hormones, diet, exercise, and also focusing on repairing the degeneration that you may have within the back. So
and so, is there a test you do for this? Do I have to get an MRI to come in? How do I do
well,
this?
the first step is to come in so I could talk to you, take your history, examine you. And the beauty of the iPad Pro now that I have is, and with AI, we can talk. I don't have to write anymore. And our conversation goes into this perfect, medical note on the iPad. I would probably recommend doing an MRI of your back so we can see every component of your back, every bit, a little bit of it. And then when the blood work comes back within a week, we can sit down and go over that and see if we have to correct your thyroid, DHEA, testosterone, et cetera. So it's the best way to start because it covers every part of the picture, every base.
All right. So I will call the office, I guess, and make an appointment.
Yeah, we'd love to hear from you. I'd love to help you out, of course.
Call the radio?
Excuse me?
I said, can I skip the line since I called the radio show to get in?
Yes, you can skip the line, of course. 516-794-0404 is the phone number at the office. Call and say that you spoke with me on the program, and we'll get you in as soon as possible.
You're a gentleman, Doc. Thank you very much.
Thank you so much.
Thank you for your
time.
Great
questions, too. Great call. When I started radio 100 years ago, it seems, which is really probably 35, 36, 37 years ago, people would call and ask very basic questions. I have this, I have that. And now, because people are so much more educated and want to read and learn, they're bringing questions together that are complex, which is great because life is complex and medical issues are complex. They're not just simple and, 1, 2, 3, take a pill and you're fixing everything. So I like the fact that people are thinking, 3 or 4 or 5 steps ahead and thinking in a way that's much more complete. It's just a better way to understand things when you have everything all laid out on the table for you. Again, phone lines are open for 888-420-9272. You could contact us through Instagram as well. You had a lot of Instagram calls the last program. So you can take a moment and get...
I think we started with one. Before we even went live, we had a question.
We had an Instagram question.
We did.
Okay.
Getting it up.
Let's see if we can grab that.
And that's our phone call.
Okay. I hear a little ringy-dingy in my ear.
There we go.
So.
Hello.
Hello.
How's it going?
Yes, sir. How are you?
Good. How are you?
Great. Enjoying the day so far?
Yeah. It's I'm in Florida. It's pretty cool down here, though.
Okay, very nice. Warmer than here. What sort of medical issues are you having? Or what's your question?
So, my question was, how do heavy metals affect testosterone levels? Because I'm young, in shape, 21 years old, worried about kind of my testosterone levels and such, because I want my energy to be good. I want to be able to wake up early in the morning and sleep well. So how do heavy metals affect that?
Well, metals can get into any tissue they want. They're not held back from going anywhere. And there's literature I mentioned a moment ago about brain degeneration, even brain cancer, because metals get through the blood-brain barrier. So when they reside in tissues, they cause damage to that tissue, and they're not letting that tissue function in a normal fashion that it should. There's an extremely common mechanism for people that have heavy metal exposure, some people that have fillings in their teeth that are mercury. The mercury and the fillings are inches away from your thyroid, and we know that heavy metals can damage the thyroid gland and cause an autoimmune thyroid disorder, which means your body's attacking itself, and your thyroid's not being made in the appropriate fashion because those cells are damaged from doing their normal job. And I also mentioned that heavy metals interfere as to how minerals work on receptors of your cells. They cause inflammation, free radical damage. So I believe that in the younger population that has the exposure, they're going to see some issues with hormone production, including testosterone.
Right.
For women, estrogen, progesterone. We also know that metals may play a role in decreasing fertility. So they can affect and damage any part of your body. And typically I'll tell people, go online, go to Google Scholar, which is a great search engine, and plug in that question, can heavy metals do this? Can heavy metals do that? And every time I've looked up a disorder, because we have a sheet in the office that lists all the diagnoses that we see and have for years, and I looked at every underlying differential diagnosis, you see heavy metals correlate with damage to just about every tissue. So even those that are in their 20s, we've had 20-year-olds that have low thyroid, but didn't understand why.
Yeah. So what's the best preventative measure to kind of detox from heavy metals that could affect your hormones? Like personally, I know that I've read and heard online that doing a sauna, infrared sauna will help, and I try to do that a couple of times a week. That's
a great comment, but let me be a little bit more scientific. You want to test to see what metals you have first, because if you do a blood test, which is the tiniest peak, you may not see anything, because if you don't have any metals near the needle for the 3 seconds it takes to fill out one tube, and one tube is for vitamins, one tube is for chemistry, one tube for hormones, another tube for metals, so if you're looking at blood only, you may not see much. That's why that's just a first quick, peak. That tells you what you recently were exposed to. It has value, but it doesn't tell you what's been going on for years. The next step is to do a urine test where we're looking at 21 metals coming out of storage, and we're looking to see how much are represented in that urine test. If you have a lot of arsenic coming out, it usually comes from chicken, shrimp, rice, apples, California wine. So we may change your diet, maybe go to completely organic chicken, get rid of the California wine if it's on the list of the 30 vineyards that are being, investigated. Apples have to be organic. So that's one part of the picture we would talk about. For people that have high aluminum, it's in antiperspirant, pots and pans, aluminum foil. Metals are everywhere. If it's, lead, obviously. We just told an older couple who live in a home and has lead pipes to have their water tested, because I think that their lead exposure is coming from what's happening in their home. So triple reverse osmosis filtration systems are good for that.
Yeah, I just got the reverse osmosis system, and before that I was trying to do bottled water.
Bottled glass bottles are good.
Yeah, glass.
Especially because of the plastic garbage, and the plastics and the chemicals in plastic. So the first step I'd recommend is doing the blood and then a urine test to look at the metals. If the blood and urine show significant, which they always do, the next step is to do an IV that takes about 20 to 30 minutes to do, which will grab the metals, pull them into the urine, and you collect that urine for 12 to 24 hours. In doing that, you're able to capture and see what's coming out when you pull it out. That's your best picture of what your body's holding on to. And then typically that IV is done for 10 treatments. At the 10th IV, you do the urine after it again, and now you have the urine from the first IV, the urine from the 10th IV, and you can see what you've removed from your body. Fact, proof. You can prove that you're getting them out of your system. Now, there are people who like saunas. I think they're great. Infrared saunas are great. There are people who like chlorella, spirulina, foot pads, and foot baths. But these things just don't have the science behind it. What I mean is that, you get the foot pad or the foot bath. What's in the bath that you're putting your feet into? Where's the proof that it binds to these things, pulls them out of your body? Where's the before test and the after test to prove that they're gone? No one's testing the foot pad or bath to see what's there after using them, so there's just no science to that. And I've seen people that have used everything you could imagine to try to bind and pull out metals and what people call toxins. I say, well, what toxins are you trying to get rid of? So it's got to be a more scientific discussion about this. So when we do the blood and you do the urine and you do the IVs and you can repeat and show that the metals are depleting, that's proof. So that's the only thing I would ever recommend, because there's ultimate science and proof with that.
So the first step would to be identify it. And
exactly. First step is to identify what you have. And also, when I see people in consultation, I have them write a list of all their symptoms and problems from head to toe. So anything from your hair changes, your memory, focus, concentration, word retrieval, thought process, vision, color vision, smell, taste, go from your hair down to your toes and list everything you think has changed or is not the way that it should be. irregular heartbeat, palpitations, bloating, stomach, whatever. And then as we start to look at the picture and we find out maybe your vitamins or hormones are off, if we're looking at the metals as well, we find them and we start to correct by removing them. I want you to keep looking week to week at your symptom list to be able to show me which things are getting better. That's the ultimate way to see your best and some of your more significant improvements.
Right.
And again, in doing this, I've been a physician for 39 years now. Wow, scary. Doing many thousands, I'm sure into the 100,000s over that many years, we've seen patients with great results getting rid of these things because they're all bad. There's no benefit of them.
Yeah.
And I feel like saying, you name the organ problem or you name the issue, I'll be able to find literature on how heavy metals are probably affecting that. Because I've looked at so much of this.
And would you say like the food being ultra processed as well could affect metals getting into your body?
Well, yeah, absolutely, positively. So in California, there are vineyards, 30 vineyards the last time I looked, that were under review for too much arsenic in their wine. And what they typically have done, and again, this really doesn't happen in Italy and France and some of the European countries because they're more religiously strict about their production of wine. I'll explain that in a minute. But if you spray arsenic on the grapes, then the bugs that damage the grapes can't do that, but then you're exposed to that arsenic when you drink the wine. So if you go online and you look at arsenic in wine or California wine or sometimes Chilean wine from South America, you'll see that. It shows that they use that to prevent the grapes from being damaged. Same thing with chicken. So forever, and there are companies now that don't do this, but for many years they use arsenicals to put into chicken feed so it kills the bugs that chicken would normally get sick from or end up creating a poor, product to hit the market. So apples, the same thing. That's why rice. So everything should be organic. Everything. It's going to cost a little bit more, but, you really have to get as many of these chemicals out of the picture. Same thing with aluminum in pots and pans, aluminum antiperspirant,
Yeah, what about red meat? Like, would it have to be organic?
Should be organic, yeah. I mean, absolutely. I think everything should be organic because there was a book years ago that I bought, because I like trivia and all sorts of interesting tidbits of sometimes nonsensical things, but I bought this book by Richard Lewis, who was a PhD, not the comedian, rest his soul. And it talked about different chemicals they put into foods that don't have names. It's just numbers and letters and codes. 65 chemicals in chicken, 75 chemicals in beef. And, when this is heated to this temperature, then it becomes, more dangerous or more toxic. It's a crazy book if you were to read it. But you want to have the food that has the least chemicals of all in it because they're not to your advantage. They're not helping you any.
Right.
Another comment that comes to mind is that some people have allergies and they have stomach issues or bloating or rashes, and we test to see that they're allergic to a food. And we take that food out and their symptoms go away. There are some people who react to that food, but the testing doesn't show allergy, but it may be a reaction because of the chemical in the food, or chemicals, plural, the GMO nature, because a lot of grains and things are GMO now. So there are multiple ways for your body to be irritated by a food, not just by the pure food itself, because a lot of people do have that food allergy, but chemicals and GMO. So we talk about that with patients and we kind of tease that out. And any food that you think you're having issues with, once we do the workup, keep them out of your diet and just keep, going organic.
One thing I recently cut out of my diet was seed oils and highly processed oils like canola oil, vegetable oil.
Makes sense.
Soybean oil.
A lot of talk about that.
And I transitioned to grass-fed butter, ghee, avocado. I don't know how you feel about avocado oil because I know
avocado oil is typically good. Again, as pure as you could possibly get. Makes all the sense in the world.
Yeah.
And I love the fact that RFK Jr. is, steamrolling through with all these comments and getting people to try to exercise and eat right and bringing all this information, to the forefront. I think this is long, long overdue. But I think He's doing a terrific, terrific job. I would love to interview him someday. Chat with him about all this. I think he's awesome.
He is awesome. And I just saw that they banned Red 3 as well.
Yep, it's happening. It's amazing to me that all this garbage that we're now figuring out that's been around for so long in a variety of areas, I'm not going to go too specifically, but I think people understand what you're talking about, foods and such, and other areas, is being exposed. We're seeing this. We're seeing that other countries don't use all this garbage, and they may have three things in their food, and here there are 20 or 30. You know, we really need to read and follow the people that are giving us this really good information. You know, support them, comment to them, thank you for doing this. I do that all the time. You know, we have to stand up and fight for better, purer foods and more knowledge. Absolutely.
Yeah, I saw that in Europe, seed oils are banned there.
Yeah.
Like they don't really use seed oils.
A lot of things are banned. I think Giorgia Meloni, the Prime Minister of Italy, was one of the first to ban this fake meat, or whatever they're trying to force on us.
Beyond meat.
You know, and there are people out there who are unscrupulous and dangerous, trying to destroy some of the foods that we know and like and we know are safe for us, and trying to come up with all these alternative things. I don't like that.
Right.
Meat glue has been around for a long time. Hopefully we'll ban that. I watched a video on something where, and this is pretty interesting, people were going to restaurants to eat scallops. And you know, a scallop is a shellfish and looks kind of like a clam, cool scallop shell. And then researchers went in and took samples of that. It wasn't scallop at all. It was some sort of weird glue and paste that they made to look like scallop. This is insane. You know?
Yeah.
So I love the fact that this is being exposed. A few years ago, I saw a video on meat, and they were focusing on meat glue. So if you take the worst cuts of meat and you take different things that you wouldn't eat and old and sort of degenerating meat, and they sprayed it and used chemicals and colored it and used the meat glue, it came out looking like a beautiful steak. I said, God, that is scary. Because it looks great. It'll sit on the shelf in the supermarket and probably look great for a while because it's all chemical, but you really got to know where to get your best foods from. I'm sure, you know, local butchers are better than some of the places that people buy things, but learn and read. Let the buyer beware, you know, learn as much as you can.
Yeah.
Never be satisfied with the status quo.
Yeah. And then I recently, you know, in the past year or two, I stopped with Gatorade and the sports energy drinks because all the stuff they were putting in it, it's just full of sugar.
Same thing.
And then red 40, blue 1, yellow 5.
Look at all the sugar in sodas and things. It's a massive amount of sugar. 30 grams, 40 grams, 50 grams. You know, if you want to have something that's carbonated, go out and get a very simple, safe, carbonated beverage and, you know, put some fruit juice in it. Organic fruit juice.
Yeah.
You know, make it yourself. Have a lot of my patients do that with their foods, with their preparations. They're getting everything organic, and they're creating their own, you know, combinations of food. One thing that, and I talk about this every day, all day, so, and I could probably go on and talk about this for hours. People, I tell them to get away from the rice because of the arsenic effect. Well, what am I going to have?
Yeah.
Which is not one of my pet peeves. Well, maybe it is, but what am I going to have? There's so much to have. How about going out and get cauliflower rice, chopped like rice, put in a pan with garlic, olive oil, put some tomatoes and peppers in it. You could season it whichever way you like, and you have a big bowl of not rice, but it's great vegetables. It's amazing for you, and there's no negative to it, no downside. I'm going to have to go out and find some good healthy cookbooks that are doing grain-free and low-carb, that sort of thing, and start to recommend them to people because people really need to know how to cook and prepare things to make it super healthy.
That's interesting. I have another question because we were talking about the sugar before. So I see that like a lot of these sports drinks or, you know, whatever, they'll have stevia leaf or monk fruit extract. What like it's like obviously a fake sugar, artificial sweetener, but how harmful could those be to your
I think monk fruit's relatively safe because that is not a bastardized chemical substance. So I think the more natural things are healthier, agave. But on the other hand, I don't want people to keep desiring that sweet taste all the time because sooner or later they're going to go back to the things that are bad for them. I'd rather you have a healthy appetite but not want to have sugar all the time, whether it's the regular sugars, even though they may be healthy, you don't want to have too much sugar because sugar can damage your blood vessels, damage your nerves. There's something called glycation, which I'm going to have to do a whole show on that talks about how sugar damages inside your cells. There's a lot to talk about that. So I don't want people to have a real sweet tooth and constantly want sweet. I'd rather have their body regulate out, and you can have a little bit of something now and then that's a little bit sweet.
Yeah. Well, the way I try to stay away from the sweet stuff is I'll eat my meal because I usually get the sweet tooth at night, and then I'll just eat a lot of fruit after my big dinner that I have. So
I mean, you could
wouldn't crave a lot of it.
I would have a little bit of it because if you're having a lot of fruit and there's sugar in fruit, your body sees your blood sugar go up, you release more insulin, you dump your sugar, and the insulin knocks your sugar all the way down, and then you start to crave because your blood sugar is low. When you're tight with the carbs and you're doing exercise and everything else right, you're not craving. So again, without knowing everything that you eat, et cetera, or what your body's doing, just tightening up a little bit. Fruit's great for you, and I think berries are the best because they're the lowest in fruit, sugar rather. So you have to fine-tune that a little bit.
But the berries, though, I see they spray them a lot, so that
you've got to get organic.
Will have a lot of chemicals.
You've got to get organic.
Thank you, though.
Yep. Thank you so much for your call. Great questions. You're totally into it. I think that's awesome. I'm very happy to hear that you're reading and learning and looking that you want to do better and better. That's great. I wish everybody that I saw will have the same sort of drive and desire. Call the show anytime you want. We'd love to hear from you. Thank you.
All right.
What was your name?
So much. Parker.
What was that? Arthur.
My name is Parker.
Okay, cool. Thank you so much for your call.
All right. Yeah. All right. Thank you. Appreciate it.
Enjoy. Have a wonderful day. Phone lines are open, 888-420-9272. If you'd like to call in to ask a question, you could do so, 888-420-9272. We haven't heard from that many Instagram people today. Or TikTokers.
We have some, but hold on, we got another caller.
Alrighty. Another call.
Hello.
Thank you. Appreciate it.
Hi.
Hi there. How are you?
I'm good. How are you?
Great.
My name is Frank. I'm watching the show now, and I want to stay on the subject of the metals in the blood. My father passed from heart disease. He was a farmer.
Sorry to hear that.
Yeah, I was many years ago, but so in the quest for my own quest for trying to, eat healthier, be healthier, stuff of that nature. What can you do? Like where is most of this arsenic coming from in our regular diet?
Typically, commonly, arsenic, because people do eat a lot of chicken. I think chicken is one of the more common things that people eat where they expose themselves to arsenic. I don't think people are eating 100 apples a day or a week, but, rice, chicken, shrimp, rice, apples.
So it's actually what the chicken are actually eating, in other words.
Yeah. They feed arsenicals, which are the arsenic put into the chicken feed, so the chicken don't become sick and become a poor-looking product to try to get to market. So that's probably the biggest exposure.
And what about water and things of that nature?
Well, you've got to test the water. I've seen some weird things, and people will have their home water tested and bring in the report showing they have all sorts of different things and metals and such in it. It depends on whether you have well water or not. And everybody who owns a home, I say, you got to go out and get a triple reverse osmosis filtration system to put it on the water coming into your house. So every speck of water is ultimately perfectly purified. Bathing water, showering water, drinking water, cooking water.
What did you say that was? I'm writing it down.
Triple reverse osmosis filtration system. Some of the better ones are made by Culligan. That's a famous company, Culligan. Aquapure is another. And there may be other newer companies that have come up in the past, decade. But
so this is actually, you put it on your like your water main going into the house.
So the water main
filter out the whole house.
Comes in, and then it goes to pipes that go through 2 5 to 6 foot canisters that will filter that water back and forth. And they say triple reverse osmosis, pulling all this sorts of stuff out of the water. Bacteria, virus, anything that could be dangerous out of the water. And then they'll test the water after they put that in. And you should test before you put it in, just to see what you might be exposed to. And then you see you have nothing coming out, just pure water.
That's a great idea. I'm going to look into that.
Yeah, got to do it.
That. What about like I said, my father had passed from heart issues, and how does the heavy metals and such, not just arsenic but other heavy metals, how does it affect heart disease, things of that nature?
Yeah, when you realize a heavy metal is a 2 or 3 plus charged ion, and everything in your body is an electrochemical reaction, you need magnesium, potassium, calcium, iron, all the good minerals to bind to receptors on your cells to allow for appropriate cellular function. That's one major part of it. And if the metals are there, they'll bind because they're the same charge, and now that cell is not going to function well. And it could damage the cell. If you look at free radical damage... Excuse me?
It causes inflammation as well then?
Correct. If you look at free radical damage, free radicals are steal healthy electrons off of tissues to neutralize their charge, and that's the reason why a free radical exists, just to grab an electron, but now they've just oxidized and damaged that tissue. Antioxidant vitamins stop that process. That's why you want all the good antioxidant vitamins on board. Vitamin C, vitamin D, E, etc., beta-carotene, all that. So there are multiple ways.
They stop the process. I understand that, but do they flush the metals out of your system?
They block, but they don't flush. So the importance of using a chelating agent, an intravenous treatment with calcium EDTA, we can prove how that will bind to the metals, pull them out into the urine, and after the IV, when you do a urine, you'll see those things come out. So you'll see more of them come out when you do the IV and then the urine, as compared to just doing a random urine to look for those 21 metals. And if you do 10 treatments and you repeat the urine at the 10th treatment, you could compare the first urine and the 10th urine and see how much you've depleted. So that's the science and the fact of how those metals can be removed from your system.
I mean, if you have moderate levels of heavy metals, how often do you recommend that you actually do?
So moderate is a tough word. So there's no way I could say you have 1 million particles, you have 100,000, you have 1 billion. There's no way to know that. But you want to have those levels on the secondary urine test as low as humanly possible.
Right.
Can a person that has 500,000 combined metals have damage? Yeah. Autoimmune diseases, cancer, the list goes on and on and on, all the things that we spoke about. So I'm just a big fan of getting them out as much as possible.
Will fasting help with metals in your system or no?
Fasting doesn't remove metals from your system, no.
No.
Fasting for a lot of people makes them feel better because they're not bringing in foods that may be irritating them. That's kind of common.
But I've been watching a lot of things on fasting, like 24, 48-hour fasts.
Yeah, I've seen them.
Autophagy, and it eats your dead cells and even cancer cells. And
those are comments that don't really exist. You're not eating your own cells. There's no mechanism of that. Some cells that are weak and damaged will break down, and your body may be reusing some of the components of that cell. But people that are not medical doctors, who have enough of the medical training about cellular function and all that, they will tell you, oh, it's eating this, it's doing this or that, but in many cases, they can't substantiate the things that they're saying. There's this whole discussion on alkalinizing your body, and this is an important point. You have a system in your body to keep your pH at a specific level every millisecond of the day, 7.2 roughly. If people take in alkaline foods or drink alkaline water, your body doesn't become alkaline for a minute a day at all. It can't, because you have this system between your lungs and your kidneys to control that pH exquisitely. Doctors know that because we go through hours and hours and eons of physiology. And if you take in alkaline, your body holds on to acid and doesn't urinate it out. If you take in too much acid, like vinegar, acetic acid, etc., your body will pee out and release that acid, so it keeps your pH at that perfect constant level. So as much as you hear all this stuff talking about relatively intelligent people, they're just missing all of the medical and scientific knowledge that, in many cases, physicians get when you go through medical school. So you have to be careful what they're saying in terms of doing or taking something to achieve a result. I love to have research document and prove everything I'm saying. It's why my desk is a mess here and at the office.
So you're not a fan of, obviously, of high pH water. It's all nonsense. Or high alkaline water, 9.5 pH, as some of them say on the bottle.
Let's think about that. So let's say high pH water, you drink it. What happens? It gets into your bloodstream. Your body holds on to acid to neutralize it. Done.
It just wipes it out.
Done.
It's just a marketing gimmick is really all it is.
You're neutralizing alkaline by holding on to acid, because if that pH comes in at 9 and it goes into your bloodstream, your body's got to balance that pH exquisitely millisecond to millisecond. So that pH of 9 is never achieved in your body. I would be surprised if it went up 1/10 of a fraction, because your body is constantly, unless, of course, you have diabetic ketoacidosis or some major metabolic disorder, which you may die from, but it's an exquisite balance that does not fluctuate that much, never.
So how about back to the fasting? Are you a fan of the fasting or
I think fasting is a good idea. Some people do well with that. My only concern is if you check your vitamin levels and your levels are low and you fast, you become lower. So that's not a great idea. I think if you do a fast, and some people like the intermittent fasting thing, I say that may be fine. Because if that gets your body to burn fat, burn cholesterol, burn down weight, and then when you're eating, you're taking the vitamins to keep your vitamin levels in a great level based upon the blood tests we do to prove that, great. There have been studies over the years that talk about some fasting and longevity, but I think that also goes hand in hand with traditionally Western diet is way too much food and junk food. So fasting and getting away from all the bad junk food would be a great idea. But I think fasting.
I was just watching somebody on I'm not sure if it was a study or what, but his own personal experience. He was like a holistic kind of doctor, and he used to go on fast for 7 days. And his theory is that it eats all the bad free radical cells or whatever they are that you don't want in your system.
There's no such chemical mechanism.
And so it doesn't kill cancer cells.
Yeah,
it's nonsense. Yeah,
there's nothing that could document or prove that. The word eating is not the right medical term, so I'm not sure where he may have gone to medical school. But and fasting for 7 days, let's say your immune response needs X amount of vitamin C and zinc and this and that, and you're not getting any of that. Your immune response is going to drop. That we know, and there's a million studies on vitamins that are important for immune response, your heart. So if you're not having nutrients or your vitamins for 7 days, I think that's a problem. I would certainly, with a person like that, test them before they did it, look at making recommendations. If they wanted to do it, test them while they're doing it, look at their vitamin levels a couple times through that fast, and look to see if there are any negative changes occurring. I would look at that.
Yeah, well, I mean, and how about I see where fasting can help when your body will start to, after it goes through sugar, it goes through your glycogen, and then it'll start eating your fat, and that's what a lot of people fast for, that they want to go into ketosis, and they want the body to use their own fat as fuel.
100% with that. I just think if we do it, protecting your body's daily need and requirement for nutrients, etc., I think it could be done. I just don't want people to be so depleted in their nutrients that their body starts to have negative effects. So if people like to fast, they want to do that, okay. I'm not here to force a person to do one thing or the other, I'm just trying to give them information so they can make better decisions. So if people want to fast, and check in before.
But like fat will be stored, and that can be used as energy. But the body. So what you're, I think this is what you're saying. I'm not that sharp. But
you are. You have some really great insight.
The body doesn't store vitamins, is what I'm saying. It's not going to store B. It's not going to store A, or does it store?
Well, A, D, E, and K are fat-soluble vitamins, so there's some storage of that, but that's almost a moot point because most people are very low in vitamin D anyway. So the best way to control this in a scientific realm, have the blood testing done first, see where your vitamins are. If you need to correct them, you could correct them. Some people that are low in D, they want to go on a fast, we'll give them a vitamin D shot. That could last 3 to 4 weeks. It's oil-based, so your D is going to be great for the 3 or 4 weeks.
Okay.
So I'd want to look at that first. If they want to do the fast, okay, maybe in between the time doing the fast, I would just recheck some of those parameters again. If everything is safe, great. And then look at the end. Fasting certainly burns down sugar, burns down fat as a primary fuel, cholesterol, triglycerides, weight. So if it's done scientifically, and I think hand in hand with what we're talking about with a medical professional, then I think there's advantage to it. You want to minimize the negative.
Okay, that makes a lot of sense. Thank you very much.
Terrific.
Doctor.
Thank you again.
I appreciate it.
Great
Thanks very
call.
much.
A lot of people are going to learn a lot from that call. Thank you.
Oh, thank you. Bye-bye.
Have a wonderful day. Phone lines are open, 888-420-9272. 888-420-9272. Wow, some great calls today.
Fantastic. We got some questions as well.
Questions. Let's go to questions.
Until we get another call, which will probably be before I finish this question. But we have, do stem cells help with pigment art glaucoma? That's one.
So glaucoma is a degenerative disorder where pressure increases in the eye, and that pressure, if it goes too high, can damage the optic nerve. Now, we know stem cells are great for the eye because we've seen literature, and I've seen patients that have had macular degeneration, damage to the retina from diabetes. It enhances blood flow to the area. So I think just by the proof of stem cell therapy bringing new blood flow to the area, vitamins, minerals, hormones, you'll have significant improvement with the eye. Some people have a genetic predisposition towards glaucoma. You really can't change a genetic issue, but if you can get great blood flow to the eye, I think that's a great advantage. So again, it has to be understood on an individual basis, and I would need to know as much as I could about that person. And again, we have to talk about heavy metals because heavy metals will damage your eyes. We've seen that literature. So it's a bigger conversation. And yes, one of the modalities I think would be great would be stem cell.
Beautiful. And then we have another question, just kind of general, asking, do you see patients just for regular visits?
Absolutely. Yeah. See patients all the time and come in that say, I don't have any major medical issues, but I want to see what my vitamin levels are. I want to see my hormone levels. And now, lately, everybody's asking for heavy metals. I'm sure much more so after this. But I call the approach the comprehensive medical nutritional approach because I want to learn as much as I can about you, what you're eating, how much exercise you're doing, what are your vitamin, mineral, hormone levels, any odd things happening in your family, any diabetics in your family, are you predisposed to these things? So it's a really great thorough look, and with a 20, 25-page blood test to understand what your body's doing, which other doctors just don't do. They've never done it. But I've maintained this throughout my entire career doing this. And we can find more things and fix more things. With food allergy, it's more common now than ever before, and probably 50% or so of people that I see didn't know they were reacting to a food. So when their blood test showed a positive, and we spoke about this, and we may have done a secondary skin test intradermal on the upper arm, and we've confirmed that there are allergens 2 ways, and we take those foods out, people say, wow, I haven't had a headache since I've taken that food out, or my skin's cleared up, or my bloating's gone, or my aches and pains have decreased. So a lot of people don't realize that they have something that's affecting them because they can't connect and put, 2 and 2 together. Thank you, my good man. Ooh, that vodka is strong. So, just kidding. So it's fun for me to see a person who has all sorts of problems, can figure it out. I figure it out with the blood and the testing and all. And then you change a few things and all of a sudden they say, I can't believe that happened. It brings to mind a story of a lovely young lady. I think she was 18 or 19 at the time. She, at the Plainview office a few years ago, was very overweight, over 200 pounds, unhappy in a variety of different things and ways. Her skin was breaking out and couldn't lose weight. So we did the big test on her, took out certain foods she was allergic to, started to feel better, bloating went away, weight started going down within a couple of days, and I had her track everything. And I told her she should start walking around the block, slow, brisk, fast. That's my initial recommendation. And just keep doing that for a half hour, 45 minutes. Go out 3 blocks, make a left, make a right, just whatever pattern you want to do. And weight started to come down even more. Skin started to clear up. Headaches were going away. And within the course of, I think it was about a month, she lost like 25 pounds, but in a super healthy way. She was doing so much walking and exercise, she felt great. And now she knew this was the path to getting, as she said, her life back. I'm getting my life back. You should have seen the look on her face when she realized how much better she was doing. And the great continued part of the story is she got down to a super healthy weight. She became a fitness instructor. You ever see, Frankie, the girls that are not bodybuilders, but they're either in a magazine or in a competition, and they're in amazing shape?
Oh, yeah, of course.
She was in amazing shape after a few months. She moved to California, unfortunately for her. California. She moved out to California, became a wellness instructor, fitness instructor, taught people how to eat right, how to exercise, how to bring their weight down. So she took this to the nth degree and made it part of her entire life and function.
Wow.
By the way, also, she had low thyroid at 18 because her whole family had low thyroid. So we figured that out. We gave her a tiny amount of thyroid, and the girl still writes me every now and then. But she has this wonderful, vibrant, vivid life of a super healthy, super gorgeous person in every way, and she just is happy beyond belief, which is great for me to see because, you take someone who's miserable and unhappy and they can't figure out how to get out of it. Simple changes and she's there.
Yeah, it's wild.
Okay, any other questions?
We do. Might have trouble pronouncing this one, but someone said, I want to get
phosphatidylcholine.
IV? Yes.
Yeah.
Thank you. Wasn't doing that
No one will
one.
ever beat me at Scrabble. I would be the greatest Scrabble player ever because I have all these words that are real words that no one else knows. So phosphatidylcholine is an important nutrient. It's a fat that your brain cells are made of. You've heard of choline and phosphatidylcholine and serine taken as vitamins for energy or brain function. So you can actually do phosphatidylcholine with glutathione as a piggyback, 2 little bags, and that gets into your brain. In Europe, they've used it for many, many years to help to decrease lipids in your blood, and they've talked about decreasing plaque burden by utilizing that. They call it lipostabil in Europe. And when I first took a course, I learned how to do this years ago. Whether it was smart of me or not, I volunteer. Oh, yeah, I'll do it. I got up, the doctor did the IV, and within about 10, 15 minutes, I'm looking around to just, all right, what can I go and do? I felt so energetic. My brain was so vibrant. At the break in the course, I went out for a run. I just ran because my brain and my body felt so good with it. So it's a terrific mechanism for your body. You see improvement in memory, focus, mood, concentration. Literature also describes how it helps to pull out heavy metals, pesticides, chemicals, a variety of things. And that's literature that we hand out to people. So I think it's a terrific add-on when you want to improve, neurologic mechanisms, because the literature describes that, and to help to pull out metals. So, yeah, we do that all the time. But we do it with glutathione. It's got to be together.
Got it.
I might comment that you're flushing out the bad and then protecting with the glutathione, putting a little bit of a shield, as it were, over your cells and maybe your brain. That study with Parkinson's when the people had passed, they found heavy metals throughout every part of the brain and no glutathione. That's one of the studies that makes doctors think that that's a great combination.
Got it. And then we just have a general question on just thoughts on peptides. I know you've gotten into this a bit.
So peptides, I think, are terrific. These are non-drugs protein sequences that your body utilizes to improve your function. So we can talk about different peptides, and one of them is NAD, nicotine adenine dinucleotide. If you think back to high school chemistry, it's the factor, cofactor, coenzyme, that allows oxygen to be converted through a variety of steps into 36 molecules of ATP, which is energy. So as you get older and you don't have the NAD there to do that, you don't have the same energy. And if you look at studies and you look at people that are doing the NAD, we only recommend sub-Q injection because people get direct result with that. I've seen people take lots of other cofactors, precursors, and not get any result or benefit. People see relatively immediate, within 10, 15, 20 minutes, focus, concentration, memory, mood, word retrieval. You're just sharp and focused. And people do extremely well. The literature also describes how it helps to repair cells, repair DNA. So we give out a big handout, 5-page handout that describes it. Research goes back well into the 1920s and 30s. And even Otto Warburg, one of the most brilliant people in the history of the world, who won the Nobel Prize for proving that glucose is the primary and only real fuel to make cancer cells grow. The Warburg effect is that when sugar isn't around cancer, the receptors suck it up, and that's why cancer cells grow a lot faster. And then a wonderful anti-cancer therapy that's done by Dr. Forsyth in Reno, Nevada, utilizes that understanding to have unbelievable outcome with his cancer patients. But again, another story. So I think peptides are really important for your body. Other peptides like Samlund or IGF-I are the active components of what your body has always made as growth hormone. When you're born, you have a lot of it, and you become a relatively tall adult from being a baby, in that many years, 14 to 18 years. And then as that dissipates, your memory, focus, sleep, hair, skin, nails, sexual drive and function, organ function declines. And even studies going back to the 1980s with a Dr. Rudman, who had his research published in the New England Journal of Medicine, and his title was utilizing a little bit of growth hormone to create the IGF-I to repair your organs and to improve cognitive and brain function. And that's been around for a very long time. So using Samlund gets you to make your own IGF-I, which helps all of those areas. So there's a long list of peptides. I think you want what your body has always had and bring you back to where you were with what you've always had. If you try certain things that your body hasn't ever had, you may or may not get that benefit. And sometimes you have to fix your core nutrients and core hormones and core peptides to get your best result. So peptides are good.
That seems to be it.
Okay.
Not bad.
That was a quick 62 minutes, 17 seconds.
I started that a little late, too. More like 65.
Good stuff. If anybody's interested, give a call to the office, 516-794-0404. Go to the website, drcalapai.com. Great videos, working with the web people to put some more stuff on there, put the podcast there. A lot of good stuff happening. If you want to have me talk about a topic, you could go to the website, email me. We have tons of emails coming through the website. Maybe tomorrow I'll highlight some of the questions we get through the emails on the website. And we'd love to hear from you anytime. So we'll be back here tomorrow live at 2:30, give or take a little bit.
Plus or minus.
Yeah, because it depends upon how crazy the schedule is in the office on Saturday, but should be roughly 2:30. But we try to give you a heads up just in case. Thank you for watching the program. God bless you all. Thank you for the calls. And we'll talk to you here tomorrow. Bye-bye now.